guys, it's me, Dr. Jeff. Welcome to my channel, Never Look Back Pain. I'm an advanced trained, non-surgical spine specialist and chiropractic veteran of 20 years. I enjoy coming to you every week, giving you tips and tricks on how to help yourself, educate you, because back and neck pain are a chronic issue. I've been doing this for 20 years. I'm the clinic director and owner of the Midwest Disc Clinic here in Northeast Indiana. I am also author of the book, Never Look Back Pain, a simple guide to the cause and care of back pain. Why did I write this simple little book? Why did I write this simple little book? Because after 20 years, I have seen a pattern, and the pattern is that there are still patients to this very day that come to me 20 years later that I've seen over and over, new patients every single week that have been to doctor after doctor, including their medical doctor, including their other chiropractors, their regular chiropractors, including physical therapists and all sorts of practitioners, and they still don't have a proper diagnosis as to what their neck or back pain is coming from. And if you can't get a proper diagnosis, you cannot get a proper solution. So I wrote this book. A couple simple chapters out of this book. Number one, what makes a healthy back and neck? What makes a healthy back and neck? Why are there some people who have no pain? Why is their back healthy? What makes a neck or back that's not so healthy, and what causes the pain? There are 5 pain generators that I've personally found over the last 20 years, and we talk about that in this book. I also have a chapter called 5 Ways You Unknowingly and Daily Hurt Your Necks and Back, and 5 Ways to Prevent That. So this simple little book is an awesome guide for those that are looking to find out, hey, what test should my doctor be running right away? And if not, fire your doctor. What test should be finding out what? And so you can get this book at neverlookbackpain.com in a few short weeks here. It'll be up on Amazon shortly. But again, I'm the author of Never Look Back, a simple guide to the causes and care of back pain. So let's get into today's topic. How to get rid of a stiff neck. But before we talk about that, we want to talk about there could be multiple causes of stiff and painful necks. I'm going to talk about one today called spastic torticollis. You know the one, you either wake up in the morning, went to bed fine, and wake up and you have to lift your head off the pillow and turn because your head feels so heavy, or you were painting for hours or had your neck in a weird position and within hours it tightened up and it was so painful in the front to swallow, it was painful on the side, your head felt heavy, you had headaches, the pain was outrageous and you just couldn't take it. That's called spastic torticollis. The first thing I'm going to let you know is the pain is really worse than actually what's going on. So again, I've seen this thousands of times over the years. I'm here to let you know that the pain of spastic torticollis is actually worse than what is going on. I'm not saying the pain's not bad. I'm saying many people start going through their minds what could be going on, and truthfully, what is going on, which I'll explain in a moment, is not as bad as the pain. So let's talk about what is going on. So as we can see here in this picture, we're pointing to something in the spine called the facet joints. It's the joints where the top bone meets the bottom bone. Now, in a normal working facet joint, as you're watching this video here, it moves up and down within a certain range of motion. Now, I want you to picture something. I want you to picture saran wrap around this joint. Picture saran wrap wrapping around this joint. That is called the capsule of the joint. And the capsule of the joint can only be stretched within normal limits. Now, if we look at this next video right here, we see that the spine is stretching the joints way past their normal limits. And what happens is that capsule stretches past its normal limit. Think of this. Think of somebody who has hair, obviously not me, but think of somebody who has hair, if it's you, grab the top of your head, pull on your hair, you won't feel it until a certain point. Once you keep pulling, your scalp lifts up and goes to a certain point, and then you start having massive pain. Well, think of the facet capsule like hair being pulled on your head. It can stretch to a certain point. Once it goes past a certain point, now you're running the risk of damaging this capsule or this ligament saran wrap type material. And what happens is it stretches, and there are nerve endings in there, and the body, the nerve endings tell the brain, hey, we're going to damage this joint if we don't stop this. And it becomes swollen and inflamed. And then the nerves tell the brain to start taking all the muscles in the neck in the front, the side and the back, and tighten them down. preventing future and more stretching of this capsule so you don't tear it. So all that muscle tension you feel in the front and the side and the back is called muscle guarding. It's there specifically for a purpose. So I'm telling you that without the absence of major trauma, if you wake up or you're bending wrong and things like that, you've created what we call facet capsulitis. It is not as bad as the muscle guarding feels. The body's doing that on purpose to protect the joint so it doesn't continue to stretch and allowing it to heal, because now the joint is swollen, the capsule is swollen with fluid, and now the body needs time to actually heal the sprain of the ligament. And that's where over time the muscles will start to relax. Now, the pain is not good. The pain feels really bad. So what do most people do? They'll go to their regular medical doctor and they'll get muscle relaxers. Now, I am not your doctor. I am not prescribing you and telling you what to do. Here's the thing. I'm just telling you, be careful of taking the muscle relaxers because the body's naturally guarding against you stretching and hurting that capsule and stretching that ligament further. So when you take muscle relaxers to relax the muscles, you're relaxing the body's natural guarding mechanism. And when you do that, you feel better, but you run the risk of, because you feel better, now you're going to go back to normal bending and twisting and moving within a short period of time. And now you run the risk of actually damaging that capsule or that ligament even further. So again, I am not your doctor. I'm not giving you any advice. I'm telling you what we've seen that works in our office with our patients is heat, moist heat, hot shower, hot wet towel, not dry heat. The heat, the moisture dives deep into the joints and will bring necessary blood flow to the area for about 15 minutes. And then our patients, we will advise our patients, again, I'm not telling you what to do, but our patients will immediately use ice to calm the inflammatory process down. And then they'll ice every hour for about 15 minutes. I'm going to tell you it's going to take about a week, 10 days to 2 weeks for the muscles to relax. You can also very gently relax, very gently massage your muscles, not a deep tissue massage, but very gentle massaging towards your heart to get all the inflammatory chemicals out towards your heart. And then you can lay down, often by supporting your head and laying back and trying not to move. And then very gently, as you sit up during the day and you get your neck moving, you can very gently be doing left and right ranges of motion, back and forward ranges of motion to reset the ligaments, the nerves, and the muscles. Again, it's going to take about 10 to 12 days, sometimes 14. You can also use like an icy hot, a biofreeze, things like that to get rid of the pain. But again, I'm not your doctor. I'm just sharing what we do with our patients. So again, the pain is worse than what's going on. If it lasts any longer than 2 weeks, that is a reason to go see your doctor. You might have done more damage. You could have a disc injury, things like that. And your doctor should properly diagnose this through orthopedic testing, x-rays, possible MRI, all the ways that we tell you here in the book. Your doctor should be able to find out what's going on. If they're not, you got to get rid of them and find somebody who can. My name is Dr. Jeff. Welcome to my channel, Never Look Back Pain. Please subscribe. Every Thursday or Friday I put out a new video to teach you. There's an epidemic in this country. Millions of people have neck and back pain. They still don't know what's going on. So we're encouraging you to like, subscribe, share this with somebody, get them the information. If you want to grab my book in a few short weeks, neverlookbackpain.com. If you'd like some free information and my monthly newsletter, freebackpaintips.com. Right now, go to it. The link below, freebackpaintips.com. You can sign up for my free monthly newsletter. Been doing that for 5 years. Thousands of people get it. They love it. There's funny stuff in there. We teach you some things, so it's a great newsletter, totally free of charge. I'm Dr. Jeff of Never Look Back Pain, author of Never Look Back, A Simple Guide to the Causes and Care for Back Pain, clinic director of Midwest Disc Clinic, advanced trained, non-surgical spine specialist, and 20-year chiropractic veteran.